My name is Dr. Ken Alleyn, a sports medicine and joint reconstruction surgeon. And we have a series of videos that we're going to discuss some of the more common things that we see here in my orthopedic surgery and sports medicine practice. By way of background, I am a board-certified orthopedic surgeon. My training has occurred at many places around the country, including Williams College, Medical School at Wake Forest University, Howard University Hospital for residency, Yale University for my sports medicine fellowship, and then a research fellowship at Harvard MIT in Cambridge. The majority of my practice are problems of the knee and shoulder, and our practice here at Eastern Orthopedics and Sports Medicine ranges from school-age kids to active seniors, professional athletes, collegiate athletes, and Olympic athletes. So we have a pretty diverse practice. What we'd like to do today is discuss a series of the more common things that we see in hopes that it will help to direct our patients in their care to ask the appropriate questions of their doctor and to make sure that they have good information in regards to their orthopedic concerns. Common problem in the shoulder that we see in sports medicine and orthopedics are ligament injuries to the shoulder. Now, we see them quite frequently in the young active population, particularly in what we term as overhead athletes. Pitchers, volleyball players, javelin throwers, people who use their shoulder a great deal. Even swimmers and basketball players can undergo these problems. Often, patients who have dislocated shoulders will also injure the ligaments in the shoulder. To point out, the shoulder, as we know, is a ball and socket joint. That ball and socket is held together primarily by ligaments, these flexible rubber bands that connect the ball to the socket. Because of the flexibility of these ligaments, the shoulder has the tremendous range of motion that it does. When those ligaments give way because of trauma or force, an underlying injury to the ligament or the specialized tissue around the shoulder called the labrum, which is like a speed bump of the shoulder. It tries to keep the ball in check so it doesn't come out of the joint or out of the socket. When that labrum is injured, as you can see here we see a labrum uninjured, this is a labrum that's injured, it makes it quite easy for that ball to slip out of the socket. It also can be a very painful process, and it gives the shoulder a sense of instability and can lead to a significant amount of dysfunction for a patient. These labral injuries, a common one being the Bankart injury, again primarily, particularly in the older population, are treated with physical therapy and medications in an attempt to stabilize the shoulder and decrease the symptoms. In younger patients, meaning those in high school and college who are actively involved in high-level sports, quite often the right solution, particularly when accompanied by a shoulder dislocation, is operative intervention. There have been wonderful studies that have been carried out by many physicians, primarily one, Dr. Bob Arciero at West Point, who noted in those cadets that those shoulders that were dislocated with labral injuries that were not repaired had a high incidence of redislocation and re-injury. The problem is every time you re-injure the shoulder, you can cause more damage to that labrum, making it difficult to repair. It's also an opportunity to cause damage to the cartilage. And the cartilage is the smooth area on the ball and socket that allows that shoulder to move smoothly. It also is the area that can be involved in arthritis, and that can set up pretty quickly in a young person if these injuries go undiagnosed or underdiagnosed. So the treatment of choice in young people who are active in sports, particularly contact sports, is often reconstruction of that labral tissue. And your surgeon may suggest that early on after diagnosing the problem. In our older patient population, those not involved in active sports or sports where there's a significant amount of trauma to the shoulder, we often will try a trial of physical therapy and anti-inflammatory medication in an attempt to decrease the pain and stabilize the shoulder. If indeed the shoulder can become non-painful and provide you with full function, then the labral tear does not need to be reconstructed. If the shoulder does not provide you with the level of function that you would like and the pain persists, then often, once diagnosed with physical exam and imaging such as MRI, the labral tear will be reconstructed. That reconstruction in most board-certified sports medicine physicians will occur arthroscopically. Again, we utilize 3 small incisions or more, small incisions around the shoulder, to sew back that torn ligament back to where it belongs on the glenoid surface or the socket of the ball and socket orientation of the shoulder. Patients after this procedure will usually require some period of time in a sling. In our office, it's generally about 4 weeks or longer in a sling. After that, you'll begin physical therapy, which may last for a few months depending on the nature of your procedure, the type of surgery that was carried out, the patient, and the diagnosis. Again, most patients are able to return to a very active lifestyle at the same level that they did prior to the injury with no pain, which is our expectation. For more information on Bankart tears or other ligament injuries, please don't hesitate to visit us at www.eosm.net.